My name is Dr. Oguchi Kalozi. I'm the Chief Medical Officer at Del Sol Medical Center. I think it's really important. We've been through a long year, 9 months of COVID-19, and we're finally getting to that point as a healthcare community that there's hope on the other side. And so the National Institutes of Medicine and Science have come out with the guidance, and that's what we're going to talk about today. I think the most important thing that it means is we get an added layer of protection. All this year, we've had the protection of physical distancing, wearing a mask, the PPE that we use in our hospitals, and the COVID-19 vaccine gives us an extra layer of protection so that our body is able to create an immunity to COVID-19. And I think that's really exciting. Totally. Nothing that we continue to do changes. Nothing that we have done changes. We still have to make sure that we're wearing PPE. When we're in social gatherings, physical distance, wear a mask when you can, not take your whole family to outdoor events, and I think that's really key. For us, this vaccine just adds an extra layer of protection. It gives our frontline healthcare workers the protection they need because COVID's not going anywhere. It's going to be here for a while. So the COVID-19 is exciting. It's new technology. It's called an mRNA or a messenger RNA. Pfizer's been approved. Expect that Moderna will be approved this week. And even though it seems new, this is work that's been going on for 17 or 18 years since we had the first SARS epidemic back in 2002 and the MERS epidemic back in 2013. FDA has approved it, about 95% efficacious in both vaccines, and really excited to get this out to our frontline healthcare workers. And I think this is going to add an extra protection to their lives and the work that they do. While the COVID-19 vaccine is not mandatory, we do strongly recommend that our frontline healthcare workers receive it. It adds that extra protection. If you have any questions about the COVID-19 vaccine, the best place to go is the CDC, or just ask me as your Chief Medical Officer and Infectious Disease Physician. But we look forward to working with you to get this vaccine. There's a lot of work that's going into ensuring that our frontline healthcare workers get it, but you are our frontline healthcare workers. So whether it's the emergency room, the ICU, those of you that have been working in the COVID floors, you're all going to get this vaccine first. And working with the National Institutes of Medicine, working with HCA in our division, we have a tiering system. You'll hear about this very soon, either by email or by text. Make sure that you keep checking and stay tuned. There's a number of things that you can do if you're interested in receiving this vaccine. First and foremost, when you get that text or if you get the email that has the survey, fill it out. That'll help us start to plan for who gets the vaccine. If you have other questions, call the number that we'll put on the screen and we'll continue to go from there. I want to thank everybody for all the hard work they've done this year. It's been a really long year and I'm sure you're exhausted. Again, I think that this starts to be that bridge out of COVID. We need to get our healthcare colleagues and friends and family to take this vaccine because I think this gets us into the next year in a better place. All the hard work you do doesn't go unnoticed. Thank you very much, and we'll continue this fight.